She was struggling with high blood pressure. And I could tell from her chart that she would see a different provider every time she came in. And she would come in every 3 months or so to talk about her blood pressure. And by the time I came in and saw her, I could visibly see the anxiety on her without even talking to her. And rightfully so. Like, I was another new provider that she was seeing, and this problem was continuing no matter what was done. So she was telling me, I just can't seem to get my blood pressure down. I'm worried that I'm going to stroke out. I smoke cigarettes. I know it's not good for me, but I don't know what to do. I'm checking my blood pressure like 2 times a day. And it doesn't seem to matter. Nothing's helping. So the first thing I did was tell her to stop checking her blood pressure so often. That it was more my job than hers to do that right now. It was going to serve her more to let me worry about it more than her. So right then and there, I wanted to take the pressure off of her and put it onto me. And I know that's a high order. Like, why would you want to be responsible for everything? Isn't that a liability issue? I mean, yes and no. Basically, it is my job to worry about you. I would rather do all of the worrying myself and worry about things that matter than have you freaking out over problems that you think are big, but maybe I don't. And here's the thing. It's really important for you to have a doctor that you trust for that reason alone. And so I'll segue more into that in a little bit here, but what ended up happening with this particular person is that I said, if you can agree to check your blood pressure no more than twice in a week and come see me again next week, let's see what happens. And so she agreed to that, came and saw me in a week at Prime Direct Health, my clinic, and her blood pressure was still high, but at least she was seeing the same provider for a second time. So she knew who I was and she felt comfortable with me, and that was a win. So I don't even remember if we made changes that day or what to her treatment plan, because she is on 2 blood pressure medicines, but we had her do the same thing. Don't check your blood pressure more than twice this week. Come back and see me again. The second time she came and saw me, her blood pressure was almost normal. So I didn't have to do very much in that instance to treat the problem, because the problem wasn't her blood pressure necessarily. It was her anxiety about the situation. So this person actually still sees me today, and I wish I saw her more. In fact, because I just like her as a person and I miss her. But she only comes in once or twice a year, and that's because she's not anxious about her health anymore. I think that's a huge win. Like, I don't find many more things as fulfilling as being able to help somebody alleviate their anxiety about their health. So I really, really, truly treasure this patient relationship that I have. And I like to use that as a good example about how we can treat health anxiety with just a good doctor-patient relationship. Because there are tricks up my sleeve that, I can tell you about, like maybe stop Googling so much. When you have a health concern, maybe actually ask your doctor first. And I know that brings up a whole thing about, well, my doctor's not that available, they don't get back to me in a good amount of time. Well, maybe find one that can, because they're out there. My other tips are, let's take a breather. Even if you are going to Google it, maybe wait 24 hours before you do. Let's go down the rabbit hole of why you're anxious and keep asking the why until you get down to the bottom of why are you truly scared or you have fear around something specific. And a lot of the time people land on, well, I fear that I'm going to die. And then I fear that my children are going to grow up without me. Those are valid fears. Those are really valid fears. But maybe you need to work through those versus freaking out about your health, right? So there's other things you can do to get down to fixing those fears, okay? Anyway, that's my 2 cents about health anxiety, and it's a huge argument for finding a doctor that you can trust. I have a lot of people with health anxiety, and I'd rather they just bring up their concerns one by one as they come up, and just know that they have somebody like me available for their questions whenever they happen. Like, I might not be available within 5 minutes, but I'm certainly available within a day. That's just the beauty of having somebody like a direct primary care doctor in your corner. So direct primary care, just if you're new to my channel, I haven't really done a video outright on it, but it's a membership model for primary care where you pay for the doctor services yourself versus using insurance. So you can have insurance and you can keep that as a backup for health emergencies, but you pay the primary care doctor yourself via a monthly fee, a low monthly fee, so that they can not worry about insurance billing and hassles and paperwork and trying to do what the insurance asks of them. No, we just get to work for our patients versus the insurance companies. So that's what direct primary care is. It allows me the time to be able to have for my patients to spend more time with you and for you. And, I'm available to answer questions. I'm available to talk to you about things that really matter. Sometimes those things are more anxiety related. A lot of doctors don't like talking about anxiety because there's not a lot that they can do for it. But I think that there is a lot that we can do for it just by being available and being trustworthy. So yeah, definitely not the only direct primary care or self-pay doctor available. And I just want you guys to know that there are resources. There are more self-pay doctors. There are doctors in the insurance world that care about you and do a really good job. They're just a little harder to find. So if you ever want to know more, you can submit a comment. I'm available to talk about self-pay medicine, about direct primary care. I'm available to talk to other doctors out there who are burned out looking for a better way. I can't give specific medical advice on this channel, but I can talk self-pay medicine all day long. You guys have a good day.